My name is Irene Spezialetti, and this is my husband, Robert. I came to Dr. Deutschman and Dr. Lumatia in November of '07. This was after a long and painful search trying to find a doctor in Pittsburgh that could help me. After 3 tries, I went on the internet and found Dr. Deutschman's Scoliosis System website. I called and I had a very long conversation with his office manager who helped me through this. How to arrange an appointment and by coming in by plane, and a lot of it was a little difficult at first, figuring out how we would get here and home within 1 day and not increase our expenses. We finally worked out a program, and I can honestly say that I'm glad I found Doctor, because of the pain that I was in before coming here. If you are my age, which is 80, you will find out, you say, why should I do anything at my age? But this isn't true. You can't live with pain if you don't have to. Do something. And that is what I did. And I do like the brace, but I do wear it maybe as long as I can tolerate it, because I have other health problems and issues. But I do wear it about 8, perhaps to 10 hours a day. And if I am ill and don't feel well, I don't wear it. But it doesn't make any difference, because I catch up over time and feel better when I put the brace back on again. I don't know what else I can tell you. Doctor, do you want to ask me some questions?
So before you started wearing the brace, what would be a typical day for you? You would wake up in the morning, would you be in pain when you woke up, or did the pain come on later?
The pain would come on later, and it seems about 4 or 5 o'clock it would become intolerable. I was simply hunched over and couldn't straighten up. And this was the time of day when I'm obligated to fix dinner. And that was a very long and painful 2-3 hours between getting dinner done, washing the dishes and so forth. Those were my worst hours of the day.
And for how many years would you say was like that?
It was about 3 years. It came on suddenly. And when I look back over the history of my family, I remembered that my grandfather had this condition. What do you call that?
Kyphosis?
Kyphosis. And a cousin of mine who passed away recently had it also, although they never did anything about it or gave it a name. So I was shocked and nowhere to turn to try to find out what was happening to me.
Okay. And then you went and, you decided to search around, you found
Scoliosis systems on the web.
On the web. Mm-hmm. And you came to New York and you were braced. And were you given some exercises to do also at
Yes.
that time?
Mm-hmm. Yes, I was at that time given some exercises.
Okay, good. How does the brace feel to wear the brace? Is it tolerable?
It's tolerable. In fact, if your back hurts, you really want to put it on in a hurry, because it lessens the pain and you're able to. I still keep house.
Well, that's
I have
great.
an 8-room house. I still keep it every day, and I'm 80 years old, and I have to be active.
That's terrific. What would you like to say about what this has done for your wife in terms of her life and in your life?
She complains less.
She complains less?
Yeah, but I've noticed that since she's been wearing the brace, her back seems less curved than it used to be. And she tells me that the brace does help her. So I help her put it on in the morning, make sure everything is centered in the front and back so that, it's on properly. And so far, it's been working out good.
That's great. So he's a big help to you?
Yes, very much so. That bolero has to be correct on the back.
That's great.
Mm-hmm.
That's great. Is there anything else you'd like to say to someone that may be watching this, that is not, is trying to decide if this is good for them or their parents?
You're never too old to get better. Get better health.
That's great.
You have it coming to you.
Thank you so much.
I agree with my wife. She complained a lot, and after the brace, now she still complains, but not as much.
Not about the same thing.
No, not the same.
Now about you, right?
Right now, that's about it, right.
All right. Well, thank you so much.
You're welcome.